Hello, my name is Karen Schrader, and I'm just going to go over my PEDS final. So first, we're going to talk about the brain abnormalities. So the first is holoprosencephaly. It's a group of malformations when the brain is very abnormal with large central ventricle. There are three types: alobar, lobar, and semilobar. Here's that large ventricle there. Next is hydranencephaly. It occurs as a result of an early bilateral occlusion of the internal carotid arteries. It's when the cerebral cortex is replaced by CSF. So that's right there. And you can see the falx cerebri right there in the center. Carotid plexus cysts are when there's a single or multiple anechoic cystic spaces within the echogenic choroid plexus. And it can be bilateral or unilateral. And they're right here. Tethered cord is next. The spinal cord becomes attached to the spinal column that contains it, and the arrow is pointing to the abnormality. Next is myelomeningocele. And it's a congenital defect in which the dorsal aspect of the neural tube fails to close, resulting in the herniation of the spinal cord meninges. And it is showing right there where that arrow is pointing to. Next is spinal lipoma. It extends from the subcutaneous tissues through a midline defect in the fascia, muscle, bone, dura, connecting with the posterior or dorsal aspect of the spinal cord, with an arrow pointing to the lipoma. In the liver, there's non-alcoholic fatty liver. It's a simple fatty liver disease, and in children, it has an increased fat in the liver, but little to no inflammation or liver damage. I guess I'll show you in here. It's you can see here, it's more fatty, and the kidney is going to be like a little darker, showing that there's that fatty liver there. Hepatic hemangioma, it's benign growth of extra blood vessels within the liver, and that's kind of all these nodules that you see in the liver. Hepatoblastoma is a rare cancerous tumor that starts in the liver and usually affects children less than 3 to 4 years of age. For the spleen, we've got a granuloma. It's benign. They're tiny clusters of white blood cells and other tissue. It's usually associated with systemic infections, and that's going to just be like these brighter echogenic areas within the spleen. Next is the accessory spleen. It's a benign asymptomatic condition in which splenic tissue is found outside the normal spleen, and that's where these arrows are pointing to. Splenic infarction is when there's an occlusion of the splenic vascular supply, leading to parenchymal ischemia and subsequent tissue necrosis, which is this darker area. Pseudocyst is next, and it is a collection of pancreatic fluid adjacent to the pancreas, and the most common cause is trauma in children. So it's this darker area right there, right next to that pancreas. Then we have pancreatitis, and that is just the inflammation of the pancreas. So here is the pancreas that's inflamed, and you can see all this fluid that's also surrounding the pancreas. Insulinoma, it's an abnormal mass that grows in the beta cells of the pancreas that make insulin, and that arrow is pointing to that insulinoma. For the bowel, we'll talk about intussusception. It is when a part of the bowel invaginates into the lumen of an adjacent part of the bowel. So that's kind of showing, you can kind of see here is like the inner lumen, and then it's being pushed into this other bowel over here. So it kind of looks like it's like a telescope here. And then here you can kind of see it a little bit more clearly. It's a little bit more obvious with that target sign. It kind of looks like a tree trunk, and the rings in a tree trunk. Malrotation, it's non-rotation or incomplete rotation of the intestine during fetal development. So here I just showed that everything is just not in its typical place. It's just hasn't been moved to the proper areas. Small bowel obstruction is also known as meconium ileus, and it's a partial or complete blockage of the small intestine, and it's associated with cystic fibrosis. So here is that bowel, and it's just clearly dilated there. Cervical teratomas are a rare congenital tumor composed of tissues not normally present at the site. So you can see here I found it in a fetus, and here's that growth in that neck area. Cervical lymphoma, it's the development of painless and enlarged lymph nodes along the side of the neck. So here are all those enlarged lymph nodes in the neck there. Thyroglossal duct cyst is a mass or lump in the front part of the neck that is filled with fluid right here. And hip effusion. This is abnormal increase of synovial fluid within the hip joint itself. It occurs between ages 2 to 10. So you can see the right hip looks normal, and then the left hip has that fluid. Dislocation. It's also known as joint luxation, and it's when the bones of the joint are completely removed from their normal ligament. So it should be, the femur should be right there, but it looks like the greater trochanter is over here, so you can see that it's displaced away. Ligamentous laxity, it is a result from a joint injury where the ligaments are stretched or damaged. It can lead to pain, instability, and recurrent dislocation of the affected joint. It's kind of the same sort of image or concept as the last one, with this being where the joint should be, and it easily kind of pops in and out there. Pleural effusion, it's a buildup of fluid between the layers of tissue that line the lungs and chest cavity, so it's just this extra fluid here. Pneumonia, it's when there's a lung infection, lung inflammation based on lung infection caused by bacterial or viral infection, in which air sacs are filled with pus, and they also may become solid. And here is not the best image, but here is showing like these ribs here. There's the pleura, and down here is kind of what you see that's abnormal. So this shouldn't be kind of, the waves are not correct here. So this is just showing that there's abnormality within that chest cavity, showing pneumonia. Cystic adenomatoid malformation, it's also known as CAM. It's a benign mass of abnormal lung tissue, usually located on the lobe of the lung. So here is showing all these cysts within the lung tissue. Hydronephrosis within the kidneys, it's a condition in which urine is backed up in the kidneys, causing them to swell. So you shouldn't see these pockets of fluid here. Ureteropelvic junction obstruction, or UPJ obstruction, is an internal narrowing or external compression by surrounding blood vessels at the level of the UPJ. Its proximal collecting system is dilated while the ureter is normal, and this is the most common obstruction in the upper urinary tract. So here is showing what is causing the obstruction there, and the rest of it is dilated. Multicystic dysplastic kidney is a unilateral disorder with multiple large cysts that distort the shape and function of the kidney. Most frequent occurring renal cystic disease in infants, and here is the multicystic kidney right there. Exstrophy of the bladder, it's a rare congenital anomaly resulting from a defect in the development of the abdominal wall while the bladder is being formed. It leaves the bladder exposed to the outside of the body. Urachal anomalies, and this is when the urachus does not completely close or reopens after birth. Here's that urachus, and you can see that it's looks like it might be patent there. And over here we can see a cyst that is formed on the other side, or this is the bladder, and then this is the start of the urachus right there. But I can't quite tell in this image. Pruden belly syndrome is also known as Eagle-Barrett syndrome. It's a rare congenital syndrome that involves anomalies of the genital and urinary system and the absence or deficiency of abdominal musculature. So you can see that big belly right there, or the big bladder in the belly, sorry. Next we'll talk about female genital tract anomalies. So the first is ovarian cyst. It's a fluid-filled sac in or on the surface of an ovary, right here. Dysgerminoma is a type of cancer that begins in germ cells in females, and it usually occurs in the ovaries. It's this whole thing. Rhabdomyosarcoma, it's a rare malignant tumor involving striated muscle tissue, and it's most common of soft tissue sarcomas in children, and it's this whole thing there. Cryptorchidism is a condition in which one or both of the testes fail to descend from the abdomen into the scrotum. So they're all up here, and they should be further down into the pelvis, but they're still in the inguinal canal there. Testicular torsion occurs when a testicle rotates and twists the spermatic cord that brings blood to the scrotum. So on the right, or for the right scrotum, you can see there's blood flow, and then the left there is no blood flow, indicating that there's a torsion. Then we have lastly is seminoma, and it's a type of cancer that begins in the germ cells in males, and it's commonly seen in the testicles. And there's that arrow showing seminoma right there. And that is all. So thank you for listening. Hope you enjoyed it.